Hi, nursing.com family. Are you getting ready for the NCLEX? Do you need to know how to pass the NCLEX? Well, if you do, we just released a new podcast show called NCLEX Flash Notes. This is the perfect NCLEX review, and as always, we've pulled out the most important info that you need to become an amazing nurse. Listen in each week while we review the critical topics that you need to pass the NCLEX exam, and each episode is going to cover a different must-know nursing topic with a perfect overview of all you need to know. Our new show is called NCLEX Flash Notes. You can search that in Apple Podcasts or Spotify and pull the show up. Again, that's NCLEX Flash Notes. Now, let me give you a preview of what you get. One of the topics that we cover in the show is angina, and here is a section from that topic. But first, what is angina? Angina is chest pain resulting from inadequate blood flow to the heart muscle, and if the flow is not restored, it can lead to further damage. Now, for angina, let's go over the therapeutic management. We have 6 different types here, and the very first one is medication management. So what are the anticipated medications that we might see these patients on? The first one is thienopyridines or clopidogrel. Second, we have heparin. Third, renin-angiotensin blockade, ARBs or ACE inhibitors. Fourth, we have oxygen. Fifth, we have morphine, but only if indicated by the facility. Sixth, we have beta blockers. And seventh, nitroglycerin per facility policy. So those are the different possible medications that we might use to treat angina. Now let's talk about our second therapeutic management would be an EKG, okay? And what we're looking for here is we're going to try to rule out a STEMI, and we're also going to monitor arrhythmias. Number 3, our third therapeutic management is to monitor vital signs. So we're specifically looking for any changes here. We're going to monitor our heart rate. We're going to monitor blood pressure and SpO2. And again, we're looking for changes. Our fourth therapeutic management is cardiac enzymes. We're going to look here to determine myocardial damage. So how much has the heart been damaged? Number 5 would be our cardiac stress test to determine the myocardial stress point. And lastly, number 6 is cluster care. So what we're going to do is make sure these patients are resting to decrease their myocardial O2 demands. Okay, that was therapeutic management for angina, and this was just a quick preview from our new show, NCLEX Flash Notes. And again, you can search that in Apple Podcasts or in Spotify and pull up the show. Listen in to new episodes each week. Again, that is NCLEX Flash Notes. Love you guys. Go out and be your best self today, and as always, happy nursing.